A board certified NUCCA office is unique in that there's a very limited number of these doctors, about 26 right now in the United States and Canada, whose focus is to determine exactly what's wrong with someone's skull, atlas, and neck by way of a trauma, and then to discover what's the specific algorithm, the right calculations for how their joints are built, plus how they're injured, and we put those two things together to come up with a right correction vector for them, and then the aptitude to make a very specific correction to their atlas subluxation complex. So it's a small group of people whose focus is to properly align the head and the neck using a system of pre and post imaging and trying to correct the patient's subluxation in such a way that it gets them better quicker, has them stay better longer with less need for repeated adjustment. I frequently get asked the question, don't all chiropractors adjust the atlas? And the answer to that is the majority do. The difference in what a board certified NUCCA doctor does is that our endeavor is not to adjust the atlas. It's to properly correct and align the skull, the cranium, the atlas, and the neck using a system of pre and post images or x-rays before and after to 1, determine what the problem is, 2, effectively measure and calculate what it needs, 3, to properly reduce and correct it, and 4, to image it after to make sure it's in the most optimal state. That's a very different thing than just adjusting the atlas. And so frequently I hear people saying, I was somewhere and I was talking to a chiropractor and they said, yeah, we do that too. And the reality is that most chiropractors do adjust the atlas, and I think they're well-meaning. What we're talking about though is a very specific skill set designed to properly correct alignment issues with the head and the neck that the traditional chiropractor isn't necessarily focused on. So it's a very different approach. Is it worth traveling to go see a board certified NUCCA doctor? And what's the difference between a board certified NUCCA doctor and someone that isn't board certified or has gone through the level 1 candidacy or 2 candidacy? It's a frequent question that we get, and so I'd like to answer it in saying that really it has nothing to do with the doctor. And what I mean by that is it has to do with properly giving the patient the correction of their atlas subluxation complex that they need. And so the reason that if somebody says to me, who would you see in an area? I'm always going to be sending them to the highest skilled doctor I can find. What do I mean by that? Well, I don't want them to go somewhere, be cared for, and not have their problem properly addressed. What I want to make sure of is if I'm going to refer somebody somewhere, that they're going to get the highest quality of care from whoever's in a region. And frequently, I would actually recommend somebody drive further or fly further to see somebody that I know is more effectively going to be addressing the patient's problem. And so it's not that it's about just board certification, it's really about effective care for the patient, excellent care for the patient. And there are big differences in any group of doctors that's out there. You could look at orthopedists. There's going to be some that are better than others. You could look at dentists. There's some that have a higher skill set or specialized training than another. It's really the same thing with NUCCA doctors. And so frequently we have people who are saying, well, what's the difference? The difference really comes down to quality of care. It comes down to, do they actually have the capacity to discover what's wrong with you? Do they have the capacity to effectively image you? Do they have the capacity to effectively study what's going on inside of you? And then once they know what the problem is and they've imaged you, do they have the capacity to correct your problem? Those are the key components. And so the reason why we recommend someone would go a further distance is because we want to make sure that that patient has their problem properly addressed, not just going to somebody and having the person do something to them. What we want is to make sure that something wasn't just done, but the right thing was done in the most effective way for the patient. To become a board-certified NUCCA doctor, it takes a tremendous amount of diligence, hard work, and effort, and really a dedication to best serve the patient. What do I mean? Well, the skill sets developed in the board-certified NUCCA process take a long time to develop. They're not easy to develop, and on average, it will take people anywhere from 5 to potentially 30 years to become board certified. It's not a simple task. The board certification process has been around for 35 years. There's presently 2 chairmen of the process, Dr. Marshall Dickholz Jr. and myself, and we're tasked with coaching the rest of the doctors up into what it is to be board certified. We also have other board certified mentors that help as well, but our job is basically charting to create a next level or group of board certified doctors that could perform the adjustic skill, the understanding of the patient's subluxation, effective imaging, and then the reduction of the subluxation, which are really the key components of the board certification program. The program is difficult. It's why to date there's presently 26 board certified NUCCA doctors. It's not easy, and if it was easy, everybody would be board certified. They're not, because it's not, and people have a different level of dedication to the work in helping patients. And so oftentimes what we find is that people don't want to put in the work that it takes to become excellent at serving people. And so that's why there's a limited number of board certified doctors. But in general, the program takes usually anywhere from about 5 years upwards of 30, depending upon how motivated someone is. And the program is also self-directed, which means nobody has to become board certified. We don't force people to. It's presently a voluntary program. And so we've got, out of 250 plus NUCCA doctors, we presently have 26 that are board certified. It would be our goal that all of them would be board certified and that they would all be devoted to giving the highest quality care to their patients, to get them better quicker, have them stay better longer, and to get them so that they have the most complete degree of recovery. That's the purpose behind the NUCCA board certification program.